Okay, so I know that first video got cut off just as we were getting into the appendicular skeleton. So going to pick back up with the appendiculars. The appendicular skeleton is going to involve your arms, your legs, and then it's also going to involve those bone structures, which are going to help anchor and hold the arms and the legs in place. So we have not only the arms, including the wrists, the hands, the legs with the foot and the ankle structure, but you also have the shoulder girdle, which is going to be the scapula and the clavicle, as well as the coccyx that are going to help hold the legs in place. When we get into the individual bones, and if you look at an entire skeleton, it's very easy to recognize the bones because you have other bones around them to really use as a point of reference. Part of what we do is bone identification where you have a deconstructed skeleton. So are you going to be able to look at a bone and just based on the features and characteristics of that bone, be able to identify it? And so I want to take a couple minutes, go through some of the major bones and really talk about some of the features they include to help that process. Now, starting with the clavicle, clavicle is what most people would refer to as their collarbone, runs from the top of the manubrium over to the scapula and forms a joint with those two bones. Now, to look at it from a frontal view is what we have here. It looks like that bone is straight across. But if you were to look at that bone aerial, from an aerial point of view, you would actually notice it has an S-like formation to it. So depending on how you are looking at this bone can drastically change your ability to identify it. So like I said, right here looks like it's a straight edge bone, looks very familiar or similar to other bones, but when you look at it from a different perspective, it can see that S formation to it, then can help you identify it as being the clavicle. The next one that we have is the scapula. Now, this is three different vantage points of the scapula. And when we look at it, the first one is the posterior view. So this is the side of the bone that faces outward. And a lot of formations that you have on this particular side of the bone. And essentially, it's so that muscles have a place to attach and anchor to that bone. The middle one is going to show you a side view. This is actually the side of the scapula that the humerus is going to form a joint. So that glenoid cavity, that is where the head of the humerus would actually fit with that bone structure. And that forms your shoulder joint. So when you hear somebody talk about a dislocation, what happens is the head of the humerus, the rounded top of that bone, was pushed with such force that it popped out of that glenoid cavity and it's no longer resting in there the way that it should. The final view that you have on the far right side, this is the explanation of why we classify the scapula as a flat bone. Because if you look at those first two images, the one on the left and the one in the middle, to say that that's a flat bone would be a bit of a stretch because you can see all of these formations and these extensions that you have off the surface of the bone. But when you get into that third view, that is the one that really explains why we call it flat. This is the anterior side of your scapula. This is the side that would actually rest and lay on top of your ribs. So in order to make that a union that is comfortable, then that bone has to have that flat formation so that it can rest on top of those bones comfortably. The next section that we have talks about the bones of the arm, and I'm going to kind of go through these collectively. So we know that within your arm, you have the three main bones. You have the humerus, one single bone at the top of your arm. You have two smaller bones, which make up the lower arm, which you guys would typically call your forearm. If you look at the humerus itself, you can see that rounded head shows up as being white in color. That is the side of your humerus that is going to fit into that glenoid cavity. So a very smooth rounded surface so that it can rest within that cavity and form that joint, making up your shoulder. And also so that the movements you make with your arm can be smooth and kind of a gliding motion and that you don't jerk or kind of have robotic movements. So that design is very important. Some of these formations you guys will need to know. If you're looking at the bottom, it talks about the condyles and the epicondyles. Some of those you are going to need to know eventually, but not all of them. So I'm not going to take the time to go through each one of those. right at this time. If you look at the bones of the lower arm, and that's the next two slides, really doesn't matter which one you look at because the picture stays the same. Again, if you're looking at a skeleton as a whole, it can be very easy to identify these bones, but looking at them individually, what are some of the things that you could pick out to be able to identify what bone you're looking at? Head of the radius or the radius bone, one of the things that is a very defining feature is that head because it's flat. And I've heard people describe it as looking like the top of Frankenstein's head. I've heard people refer to it saying that it looks like somebody just hit it with a hammer until it was flat. Whatever reference you need to remember that the top of that bone is going to be very flat in formation, but that would tell you that you are looking at the radius. On the other hand, with the ulna has almost a hook-like formation at the top, kind of looks like a C in there. And this is going to be the part of your ulna that is going to rest or fit with the bottom of the humerus. So again, when you think about the movement that your arm is able to make at the elbow, it's a very smooth gliding motion, and that is because of that nice rounded formation you have at the top of the ulna that allows for that to happen. Now, if you have these two bones side by side, the other telltale sign in comparison to be able to separate them from each other is the length. Ulna is always going to be longer than the radius. If you have the entire arm that you're looking at, trying to remember which one is the radius of the ulna, you can use their location in reference to your hand. So the radius is always going to run elbow to thumb side, and the ulna runs elbow to pinky side. So just depending on if you have them attached or if they are deconstructed and you're having to look at them individually, those are some of the main features that you can use to really be able to tell them apart. Now, the name radius actually comes from the bone movement. So if you hold your arm out with your palm facing the ceiling, and then you turn your hand so that the palm faces down, just that simple movement, if you think about those bones, knowing that the radius runs elbow to thumb side and the ulna runs elbow to pinky side, if you do that movement and look at your arm, the ulna really doesn't go anywhere. From start to finish in that movement, the ulna is pretty much stationary, but the radius is the one that is going to really rotate and move so that that motion can take place. The name radius comes from its ability to radiate or rotate around. So just in the naming of the bones, that's where the radius name came from. The next one looks at the bones of the wrist and the hand, and we've already gone through these. Just another view of it so that you guys can see where those bones are located. Still not crazy about this picture. They always show that pisiform as being stuck or as a single piece with that triquetrum. That is not the case. It is held in place by connective tissue, but they are two independent bones. The 1 through 5s on your picture, that is going to indicate your palm bones. So from 1 lining up with the thumb side over to 5 lining up with your pinky side, those are the bones that you would have through your palm. And then you get into the phalanx or the phalange bones. Those are going to be in your fingers. Proximal phalanx is closest to the body, moving out to the distal phalanx, which is furthest away from the body, and then keeping in mind that the thumb does not include a middle phalanx. So your index finger through to your pinky would have 3 bones, but that thumb is missing a middle phalanx and only has 2 bones. Looking at the pelvic girdle, so here we have the design of your hip bones. And the hip bones, you actually have 2 coxabones that are coming together, and those coxabones are held in place by 2 structures. So on the front side of your pelvis, you have the symphysis pubis, which is a piece of cartilage uniting the 2 bones from the front. So that's what holds these 2 individual bones together on the front side. And then in the back, you have the sacrum, which is going to form a joint with the 2 coxabones, holding them together from the back side. So your actual pelvis, you have a left coxabone, you have a right coxabone, and they are held in place by that piece of cartilage on the front side and the sacrum on the back. Now, looking at the next slide, the bones of the hip, this is a single coxabone. They're just showing you it from both sides. So you are looking at the inside and the outside, but this is one coxabone. Now you'll notice that there are three bone pieces here. So you have the ilium, which makes up the top and a majority of the coxa bone. You have the ischium and you have the pubis. Now, if you look at the second picture, the one on the far right, you'll notice the acetabulum, which is a very deep cavity that you have within the bone structure of the coxa. That is where the head of the femur would fit. So we have another place where we're forming a joint between two different bones. So the head of the femur would fit into that depression, that acetabulum on the hip bone, and that's how your leg connects to the rest of your body. Now this is much deeper. So this is the same setup as we have with the glenoid cavity in the arm, but this one is much deeper. Not as difficult to dislocate your shoulder, very difficult to dislocate the femur. If you ever have somebody that you hear they've dislocated their femur, you know that there is a huge amount of force involved in that. And when we actually get to see the bones and you can see how deep this cavity actually is, you'll understand why that is a very difficult bone to dislocate. Now the ischium is the bone that you sit on. So when you sit down and if you sit on a hard surface and after a while it becomes uncomfortable, it's because of that ischium bone. It's pushing on the muscle tissue, the other soft tissue that you have in that area, and so that is what causes the discomfort. So that is your sitting side on the ischium. The pubis is then going to be the front side of that bone structure. Now you also have the foramen there. You'll notice a very large opening in the bone. That is for muscles, blood vessels, and nerves to run through, just because of the amount of weight and support that this part of the body must offer. Having those muscles have that opening to be able to run through just provides some of that stability. Now, the next one talks about a comparison between the male and the female hip bones. And this kind of goes back to our forensics. We talked about if you have skull bones on site at a crime scene and you are trying to identify if you are looking at a male or a female, or if you are looking at the age of the person, some of the features that that skull can tell you. The other thing is the hip bones. A lot of information can be provided from the hip bones. Not a perfect science, but some of the things that they would look for are the ilium bones. If they are flared, meaning that they're tilted further out, that is an indication that you are looking at a female. In a male, those ilium bones are going to sit more upright, and you can do a comparison between the top picture, which is female, and the bottom picture, which is male, and just look at the positioning of those two bones. The other thing is going to be that pubic arch. So in the female, the pubic arch tends to have a little bit wider angle. Compare that with the male, you'll notice that that is a much sharper angle there, and that in turn has to do with the flaring of those bones because of how that arch is created or formed in the female compared to the male body. The other thing that you can't really see from this view is how the sacrum is tilted. In the male body, that sacrum, which is eventually going to turn into the coccyx bone, that tailbone, if it turns forward and takes up a majority of that space that you have in between those two coxa bones, that is going to be more than likely a male. In the female, if the sacrum is not tilted backwards, but sits a little bit further back, creating or keeping that opening clear, that is more of an indication of a female. And the reason for that is in the female body, that opening that you have between those coxa bones, that is going to be part of the path baby would take during labor. And if that sacrum is tilted forward and covering that opening, it's going to make it very difficult for baby to be able to clear that area. So in the female, that sacrum sits back a little bit more. In the male, it is tilted forward. Then we get into the bones of the leg. Very similar setup that we have to the arm. So one larger bone at the top, two smaller bones at the bottom. Biggest difference that we have here is the presence of a fourth bone in the kneecap. We don't have a special bone protecting the elbow like we do within the leg. So looking at the femur bone. Femur is the largest bone in the body. It is the most difficult bone to break, and the reason for that is not just because of its size, which helps, but the other thing is if you think about the placement of that bone, the femur bone gets the most protection from your muscles and other soft tissue. It is sunk in deep into the muscle tissue of the thigh, So very well protected by a lot of other soft tissue. You have some fat layers and things like that in that area. So just getting added layers of protection that we don't see with a lot of our other bones. So the size as well as location and protection from soft tissue is really going to help keep this bone from being broken. Again, you hear somebody that broke their femur, a lot of trauma going on. We have some other features that are identified here, but I want to hold off on talking about those until we have a chance to get into our bone anatomy. So right now, just looking at those formations that you have on the femur, largest bone, the head is very prominent, sits on top of a very distinct neck or extension, where then you get into that, that head-like formation on the top of the femur. We don't see that. We have a head on the humerus. There is technically a neck, but it doesn't create that actual space or form that we have on the femur. So very pronounced when you look at that femur bone. When you get into the bones of the lower leg, and again, it doesn't matter really which one you look at, the picture doesn't change too much. One is more specific to the features that you would have on the tibia. The other one is more specific that you would have on the fibula. So the names of the bones sound somewhat similar and can create some issues for different people. The two bones that we have, very distinct size difference. The fibula is a very slender bone, and the tibia is a very thick, bulky bone. When you look at the tibia, it has kind of sharp angles on it, almost giving it a triangular shape. And some people will use the T in tibia and the T in triangle to remember which one is the tibia and which one is the fibula. But very, very narrow, slender bone when you're looking at that fibula. And then the tibia, if you run your hand down the front of your leg, the tibia is the one that you can feel pushing through. So if you've ever hit your shin on a dining room table or anything like that, that tibia is the one that is involved in that pain sensation. So again, if you had to look at these side by side, if you pick up the tibia bone and can see that triangular formation, that's going to be one of the telltale signs for that particular bone. And then the length of the fibula, it is far longer than the radius, it is far longer than the ulna, and the very narrow shape to it usually makes it easy to distinguish if you're identifying it by itself. Then we get into the bones of the foot, and this is not a label sheet that you guys have had yet, but a very similar setup to what we see in the wrist and the hand. So you have only 7 bones that make up the ankle, and the collective 7 bones of the ankle are the tarsal bones. Again, over the years, just picking up on a lot of clues and things like that, trying to keep carpals and tarsals separate from each other. Tarsals are close to the toes, so you can use that T reference of tarsals and toes to remember that those are the ankle bones. We do have that number difference. There's 8 bones in the wrist making up your carpals, and there are only 7 bones in the ankle making up your tarsals. So as far as the individual names, I'm going to hold off on that until we get into that label sheet and you guys have worked through that. We'll talk a little bit more about the names. But again, the length of your foot, so the equivalent of the palm in your hand, but that long part of your foot, that is where your metatarsals are, meta indicating middle. So these are found in between your tarsals and your phalanges. And when we get to the toes, we see that phalanges or that phalanx name again. And for your toes, you have 3 phalanx. You have the proximal, closest to the body, the middle in the sandwiched in between, and then you have the distal, which are the tips of your toes furthest away from the body. Big toe lacks a middle phalanx. So just like your thumb didn't have one, big toe does not have one either. And the last slide that you have there is a little bit different view of the bones of your foot. So again, this will be your final set of label sheets. We'll go through these. I'm going to hold off on talking specifically about the names until we get into that label sheet. So next time we meet, we are going to have one more conversation about bones and bone structure, looking at joints, and then we're also going to be covering the bone anatomy terms and talking about what that can really tell you about the bone formations, what they offer to the bones, as we look at the different structures that we have present on bones throughout our bodies. So for this week, from now until we meet again on Monday, you will need to make sure that you watch the video, take any notes. Testimonials will be posted and you can work through that. Everything will be due Sunday at 11:59 p.m. And if you have any questions, please make sure that you send me an email and I will get those taken care of for you.